Morning, Sam.
Good morning, Eshwin, and all of our viewers.
Oh yes, oh yes.
Good morning to you.
And we have something very interesting today, right? We are talking about cows, which is everywhere at the moment.
Colds and
Yeah,
flus, sinus
cows and flus.
infections, all of the
Yeah,
related earaches. So all
yeah, and we'll have like
important.
a lot of movements and things today. So we have a very active video today. I mean, like we're speaking as well, but there's a lot of active things happening there as well. So before that, we'll start like our usual thing. We'll start with a prayer, and then we'll go on talking about the subject. Um, Gopika Smanam Govinda Govinda Shri Sadgurunath Maharaj Ki Jai. Hare Rama Rama Ram Hare Hare. Hare Krishna 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 Hare Hare. Thank you. And I'll do you want to start, Sam, or should I start?
You can start, I think.
I think we chose the colds and flus because of the season. A lot of people are having symptoms at the moment, so we thought, it would be very relevant for now because cold is a common cause of illness in winter. And what is a cold? Like cold or flus these are respiratory tract infections. So, our respiratory tract is infected, and that includes, your nose, your throat, and sometimes your chest. And, if further, it can infect your lungs as well. There's over 200 types of viruses that can cause common cold. So this is why, there's, we can get vaccinations to prevent certain flu viruses, but there's no vaccinations for cold. So, that's why it's that common as well. It's commonly spread by sneezing, coughing, and hand contact. So hand wash is like obviously a very important part to prevent having a cold. So you should always be washing your hands, especially if you're going outside, coming inside. Wash your hands. You've touched something, and maybe not sharing things like your water bottles, your glasses, your cutlery, because this is how cold is spread. I'm talking about symptoms. The common symptoms of cold and flus would be, stuffy, runny nose, sore throat, sometimes a cough, headache, fever, occasionally with a cold, very common with the flu, loss of appetite. Some people can have like other gastrointestinal symptoms like nausea, vomiting, and things. Um, and really, there is no cure for the colds. What we normally do with medications is we relieve the symptoms. So, if somebody has a fever, you'd be taking paracetamol. If you have a blocked nose, we have different nasal sprays available over the counter. And there's cold and flu medications as well, but we have to be you need to speak to your pharmacist before you take cold and flu medications because there's certain cold and flu medications that you cannot take with certain medical conditions. For example, is high blood pressure. If you have high blood pressure, then there's certain cold and flu medications that you can't take. There's certain medications you cannot take with your cold and flu medication. So there's interactions. Most of these cold and flu medications will have paracetamol. And if you're already taking some paracetamol, you can overdose on paracetamol. So, these are real concerns. And it's good that you talk to a pharmacist before, you buy some cold and flu medications. Always a good idea to talk to them. They have some information that they can give you and probably guide you in the right way. And naturally we can do a lot of things to relieve these symptoms, as I have learned over the years from Sam. And today, I'll let Sam go on and tell us like the symptoms that the things that we can do to relieve the symptoms sometimes.
Excellent. Thank you, Eshwin. And I find in my experience, most of the pharmacists are really good at coming in and checking whether you should be taking something and what you're on, asking what you're on and all that sort of stuff. Because yeah, it didn't even occur to me that some of the cold and flu tablets might interact with high blood pressure uh, medications. Yeah, and that would also probably be the case with some of the natural supplements. You know,
Yeah.
I do know that yeah, turmeric and garlic, things like that, which are very good for thinning the mucus. It would also be thinning the blood a little bit, so that you'd have to be careful with blood thinning medications. I assume I'm not sure that's your area, but yeah, always checking in with the pharmacist when you want to take something other than the natural. And of course, as Eshwin would always say, the one of the first things you should be increasing with cold and flu, sinus, earache is your liquid intake, water. And because it's cold, I know I tend to drink less water when it's cold.
Same.
So, yeah, so it's like I know I should be drinking the water, and then you've got to go and boil some water, and I'll drink warm water with maybe lemon in it or a herbal tea or something like that. And there's still no substitute for water. As soon as you have even a herbal tea, it's no longer water. It's got the benefits or the the attributes of the herbal tea in it. But I still think personally it's better than nothing. You want lots and lots of liquid. I mean, lots of liquid and lots of easily nourished food. So again, not a dietitian, not a nutritionist, but this is the theory of more liquid in the body so that stuff can get out, and also that you're having less of a load on the digestion so everything can get out. So soups, lots of soups. And whenever I always say this to friends, like, yeah, make sure you have lots of soups. They'll have it for like the first day or two of the cold. And I think with the cold and flu, you really need to take your health seriously the whole time. So it's not,
Oh, yeah.
yeah, it's not, I'll just look after myself for a couple of days. I mean, we should look after ourselves every day, but obviously, in this hectic Western world of life that we live, that's not always possible for people. But um, you have it, really look after yourself for 4 to 5 days, like soups every day as best you can, go different varieties of soup. You can buy some. I make chicken stock, and I like to make a big batch and I freeze it in takeaway containers, block. So whenever anyone's got colds and flus, it's the old what they call it, the old Jewish penicillin, the chicken soup, but it's actually, the chicken broth overnight is like cooked overnight to get all the nutrients out of it is medicine. Food is medicine. So I would get the chicken broth, frozen chicken broth out, and ginger, garlic, carrot, celery, just make it, and just some noodles for my kids. They love it, and it makes them feel good. I'm going I'm talking a lot because there's so much you can do. So there's so I can't really recommend any sort of product, and I guess an organization, but I can say that I use things like kuzu, which is a starch, and umeboshi plum, which is good for the liver, and slippery elm powder, probiotics, all these sorts of things I always use during colds and flu. The kuzu helps with reducing the mucus and getting it out of the body. But once it's in, once it's in, there are physical things that we can do. And I'd like to say that maybe twice in my life, maybe, but definitely once I've had antibiotics for sinus infection. The rest of the time I've done it myself. So you probably have heard of steaming. So you're getting all your liquid in, you're steaming, get a big pot on the stove and put your head over in a towel, etc.
Makes you feel so good.
Oh yeah, good for the pores, makes you feel good. And however, it hasn't always worked for me when I've got a really bad cold. And what if you're in the
Yeah.
office and you can't run
No.
off and steam, go steaming all day
And
long?
when you have children, like little children, there's
Yeah,
hot water.
exactly. So I just want to take you through a really quick, it's like a fascia lymph sort of sequence that you can do on yourself several times a day, and I swear it's amazing. And so we didn't do our double screens. So we'll take turns talking so you can see me doing it and you see Eshwin doing it. So essentially we're going to clear the sinus and ear throat canal and get some of the lymph flowing in the head. So you may find if you've got a cold at this time, it'll start flowing. And in a more holistic approach, we think it coming out is a good thing. So it's like your body getting rid of whatever pathogen you got in the body. So it's good. You actually don't want to stop that. And I know that's hard at work, but you want this all to come out is out
Yeah,
there. So
agree.
whenever you're working any of the face, because we're working the lymph as well, we want to always start with the left. So I don't know if this is left because I'm mirroring. Well, no, this is my left. Sorry. So this would be if it's your left collarbone here. This is where you open up the lymph. So any sort of massage on the face, you want to start rubbing here. So you rub up and down about 10 times. So you can do this with us. Hopefully anyone's got a cold though, or you can come back, mark this video and come back. So about 10 times, and then just lightly tapping about 10 times. And then we'll do the other collarbone. And if you say something, Ishwin, we can quickly look at you doing it.
I'm just thinking it's already making me feel better because I think, we went out last night and yeah, I have a little bit of congestion this morning. I think.
Beautiful. See, it is quick. I do it every morning. I do a whole sequence, but like tap, tap, tap as well. So you continue tapping on that side. And then we're going up from the bottom of the ear, down the side of the neck, rub, just gently rubbing, just encouraging the lymph flow. Big earrings like mine, you might want to hold them out of the way. Just gently down. And
Yeah,
again,
it's interesting. You were talking about the antibiotics as well, that you've not had the antibiotics as much. Well, antibiotic is a problem. Like, and every time we take antibiotics, we should really think about it, like if it is required, because the antimicrobial resistance is the third global problem, and it is more because antibiotics are used a lot of the times unnecessarily, or you are used in the wrong way, or not for the right duration, not in the right dosage and things like that. So yeah, I thought I'll add that in as well, like about antibiotics.
absolutely. And doctors used to give them to you willy-nilly all the time, but at least they're starting to not do that. And I read quite a while ago that apparently because they use broad spectrum antibiotics in the animals that we eat, for those, I know you're vegetarian. I used to be vegetarian a large chunk of my life, but the animals have the broad spectrum in them, and
That's right.
and we get that in them when we eat it, and we become less and less. What's the word?
We become resistant,
Yeah, we
like
become
to
more and
most
more resistant.
antibiotics.
Yeah, so
Yeah,
less and less, more and more resistant. Okay, so we just opened that. There's a whole lot of lower body stuff we can do, but we've opened this bit. So now we're going to get into the ears because this whole area is all connected. All this sort of areas connected. So we're going to start by rubbing in front of the ear vigorously, vigorously up and down. And then the back of the ear, there's a bone there, and you vigorously up and down. Nice. Now,
look, it's
fingers
warm.
front and back. Yeah, you want to get it nice and hot and warm. 2 fingers front and back. Oh, my ears and
Oh,
ears
that's
moved around.
good. Feels good.
Yep, and then you can also pull the ears. Just give them a bit of a pull all the way up. There's so many moves we can do with the head. I'll get carried away. So I'm just going to keep them to the minimum that I would do if I was doing it several times a day. So don't forget to sort of give the ears a bit of a pull. I'm going to remove my glasses. So you're going to go up and down here. Quite vigorous, up and down. Should be feeling very warm.
Very warm.
Okay, and then so I can see the corners, the knuckle on your thumb at the corners of your nostrils. Right, so get the thumb, the The glasses are not going to work. I'm going to go. Okay, now circle, breathe in. Circle, circle, circle one way, and then circle, circle the other way. Now, if you've got mucus, it's probably going to start coming. Okay, so you can just use a tissue or whatever. So I'm breathing in, making all that noise, circle, circle, circle one way, and circle, circle, circle the other way. It's quite vigorous. You're not being that gentle, okay, because you're trying to get right into the sinus. Again, we're going to do 5 of these. So the third one, breathe in, circle, 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 breathe out, circle, circle the other way. Again, breathe in, circle, circle, circle one way, circle, circle the other way. Okay, last one, big breath in, circle, 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 and breathing out, circle, circle the other way. Keep those knuckles where they are, and then just pull them along the bottom of your cheekbones. Okay, so all the way along the cheekbones towards the ears. This should feel nice.
Make funny faces.
Oh, it feels great. Uh, and then tap all over the forehead. Tap, 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 taps. A lot of this stuff that you can do it. You don't need to just have a cold or congestion to do it. It actually brings a lot of blood flow to the brain and opens up all the passages,
Yeah, you don't
cavities.
feel foggy after it, right?
Yeah,
Like,
yeah.
yeah.
So that really was just a simple, short amount of time. And you might just breathe in and out. I know I can. I'm definitely clearer. I'm just a bit
Yes.
congested
Yeah,
from
you feel
last
the
night.
difference.
Hmm.
You feel the difference. Thank you, Sam. That was lovely. Oh my God, that was just
And
beautiful. And
I'll just add this area here, under the collarbones, when you rub that area as well. I don't remember where I heard this, but this is kind of like an immune point. So it increases your immunity. So you kind of just give that area a little bit of a rub. And get outside in the sun, get vitamin D, go for a walk, don't laze around too much feeling sorry for yourself. If you're at work, get outside, go for a walk around the block, get moving and drink.
keep yourself a bit warm as well. Like, I think that's always important. Not too warm that you become too lazy when you're too warm.
And
But
a lot of the old wives' tales are correct, right? Yeah. So like, you're not going to sleep with your hair wet because of your neck. So that's it. In winter, you need to keep your neck warm, like you really do, and your kidneys. So the kidneys as well, they sort of sit in here. You can rub your hands and give the kidneys a
so
good
that's at the
rub.
back.
Yeah, in the
At the
back,
back, right? Because they
right?
can't, yeah.
Yeah, you sort of get as high up as you can, which is the bottom of your ribs. So the bottom of the
Yeah.
ribs in the back is where the kidneys are, and along with everything that you do in the kind of more holistic world, I guess, is intention. So I'm really intention. I'm believing that I'm sending good healing, warm light to my kidneys, to my neck, to my immune system. And I like what, Eshwin said the other day, um, when she gets up in the morning, I think was it for mood? And I said I do it for aches and pains as well. And it actually is an NLP technique,
Yeah. It's
neuro-linguistic
just
programming.
frustration. Like I was
Yeah.
talking about first. Yeah.
So
Yeah.
she just goes, I say go, like go away, go away. Like if I'm achy or sore, I get up in the morning, I'm like, go away, go away. And I'm like, I feel good. And I feel good. And I like might feel the aches and the pains, but I'm just like, you know, believe, tell it go away.
Tell it to go away.
Yeah. And what was your words? What were you?
Yeah, it's like, yeah, go away. It's almost like now I've forgotten what I do, but I actually, yeah, like with my movements, I'm telling it to, stay away from me. I don't want you.
Yeah.
It's like, I want to hold on to the good vibes. So I tell like all the bad vibes to go away. So yeah, yeah, if I'm not feeling, there's something that's not serving me, Yeah, intentionally loudly ask it to move away from me because I don't want that.
It's yeah,
So
it's beautiful. And intention sort of parallels or heads in the direction of visualization and imagining that, things are good. So all of those sort of techniques are being proven now. So like, high CEOs and sports people, they visualize, right? That they see themselves already winning or, already closing that deal. They feel good. This is how good I'm going to feel. And they really picture it and they just nothing's going to sort of get in the way. And like, what's the worst thing that happens is it doesn't work. But scientifically, the brain doesn't know the difference. The brain is like, yeah, I feel good.
oh yes,
Yeah, we won that. Yeah, like
it's like
so
training the mind, right?
yes,
Like whatever you tell the mind, that's what it believes. And yes, I mean, like it does work. Like like before I used to think, oh, these things, yeah, I could not relate until I started using it for myself. And then now I actually do relate to these things. And, yes, it might work, it might not work. We might not be able to prove it like the scientists prove things. But the thing is, when it works, great, it
exactly.
works.
Exactly. And that's
Yeah,
what I always say with yoga. It's experiential. It's you don't know until you've given it a good go. You've done it yourself for a decent amount of time and you feel it. And then if someone tells you it doesn't work, you can say, well, this is what it does for me. You can't tell me that didn't happen. So if you can breathe better or you feel better, well, then that's enough proof. Sure, if we're putting a medication in and we don't know what's in it and it could be put like, yeah, you've got to be careful. But when it's thought processes or just moving your own body and doing all these things and they make you feel better, they make you feel better. That you don't need scientific
that's
proof,
right.
even though
Yeah.
it's coming. There's a lot more and more studies being done. So, it's great.
Because even with medications, like yes, of course, there is times where you probably have a meeting the next day or something, and you would need like medications to feel better at that time. But then, yeah, you can't compare them to our like the non-pharmacological interventions because pharmacological things will always have adverse effects. They will have adverse effects. They might work and might not work and might cause even more issues for you because sometimes, we might be treating something just like, when we dry up all the mucus. So first day of a cold and we've now dried up all the mucus and then it just sits there. It makes you feel even heavier sometimes, so it's yes, the medications have their roles in places, like you have to go to school, you have to do stuff, and you might go for the medications, but yes, these holistic things and preventing the infection is like another important part of it.
Absolutely. And
I would like to also mention that a lot of people will take Panadol, but there was a time that people used to take a lot of aspirin, and there's a caution about aspirin. Aspirin in adults can cause a lot of adverse effects like bleeding. Um, but we should never give aspirin to children because it can brings up an acute illness. Like it sounds like so ancient talking about it, but there's a thing called Ray's syndrome. So we don't give aspirin to children. So never think of aspirin and children. They just don't go together. And then, I think, while we're talking about all of this, like we should also know when should we actually go and see the doctor? Like when would be the, time that we think, oh, we've done all of these things and nothing has worked. Like, we should now go. So with children, you have to be really careful. Like, so if children are refusing to drink fluid, they are vomiting, they're pale, their knees are getting weak, they need to go to the doctor. You need to, because they obviously need more hydration and maybe more medical interventions. If you have difficulty breathing, pale and fatigued, tired, like, you high fever, you need to see the doctor. There's no improvements after 48 hours of you trying to do stuff, or your symptoms are getting worse. You need to see a doctor. So also know when when you actually need to go and see a doctor. And sometimes people also start feeling dizzy. There's a lot of vomiting and nausea and loss of appetite. These are symptoms which will require you seeing the doctor.
Yeah, and Eshan, with the mucus, is it, I don't know if that's an old wives' tale as well. If the mucus has got a greeny tinge, is that a sign? I've heard if it's turning green, that's a sign of infection. I don't know where I heard that from. Is that a
Yeah,
thing?
that might be a viral infection. So, if viral infections, that really the doctors are not able to do much, and you would still be treating the symptoms. But if it's like really yellowish, if greenish yellowish, you'll know if you have a fever. It has a sting to it as well, and the fever will be really high. You won't be able to, the paracetamol might not be enough. That would need antibiotics probably.
Yeah,
The
but
doctor would
you
need
can
to
have
check.
you can have an infection without a fever, can't you? So, and I know that's happened to me once.
Yeah.
I didn't even know I
I
had.
think sometimes also what happens is like when people have symptoms, they're taking a lot of paracetamol, and then you don't get the fever because the paracetamol is helping the fever anyway.
Mm,
Um,
mm,
so yeah, but most of the time with infections, there will be not with colds as much. With colds, you don't have as much fever, but if there
yeah.
is other sorts of infections like influenza and things, you would have fever.
Yeah, yeah. So there isn't much to the green snot. But back to the mucus, as you were saying, with that drying up, those drying up drugs, which obviously if you're going into an exam or a meeting or something, you just can't be sniffing the whole time. Um, the drying up, like if you think of a virus, any virus, it's a pathogen which is in you, and your body is trying to get it out, right? So it's coming out through your mucus. That is part of it getting out. So if you're drying it up,
That's
yeah,
right.
like you
Yeah.
said, where does it go? Like it's still sitting there in your body, and that's why people go, I can't kick this cold. I've had this cold for 10 days or 2 weeks, and it's like, well, have you really been looking after yourself? Have you really drinking like the whole time, not just for a couple of days? You've got to.
You're giving it the environment to grow as well, like
Mm,
because now you've just dried it and then it will get wet again and grow again, and
yep.
you've just given it the environment to grow again. That's another thing. And with the yellow mucus as well, towards the end the mucus becomes yellow. That's just our own immune system anyway. So in
Right.
the beginning, if it's yellow, then it's more like infection, but towards
Okay.
the end it turns yellow because that's all our antibodies that have been working on it
Oh, yeah. Interesting.
that
Oh,
needs to come out.
yeah. Yeah. And of
Yeah.
course, colds and flus, they might suck a little bit, but they do help you get a little bit stronger. And they're
Yeah.
inconvenient, but they're cleaning out your body, and they're kind of a normal part of life, unfortunately. And
The other thing I like for I think the mucus is the honey and water. I always think that honey catches a little bit of, especially if it's in the throat a lot. The honey and water is
Well,
good.
you know what I discovered when my last sinus infection, which I was doing all those moves several times a day, and I was coughing in the middle of the night. I can't remember if it was the cough or the sinus. Actually, I think it was the cough. Apple juice. And it was someone brought around a big thing of the nude apple juice or something like that, the fairly fresh one, not completely the see-through one. And I stopped coughing instantly, and I was like, that's bizarre. And I Googled, and apple juice is actually very good for the cough as well. So, like, again, it's the liquid, but it it worked for me. May not work for you, but like,
Yeah, very
the
interesting. And then
yeah.
there's we'll probably do another video on that, but there's a post-viral cough as well, So, if you've had a virus for a while, then you probably some people will end up with this dry, irritating cough that just doesn't go away. And that is what we call like a post-viral cough. Like it has to go away by itself. Like there's a lot of things you can do, and there's cough suppressants and things that you might be able to buy from the pharmacy with the advice of the pharmacist. But yeah, like there's after the virus, normally we end up with a post-viral cough, like most of us. Yeah.
Yeah, I've noticed
Um,
that the hanging around cough thing as well, and we won't do those moves here, but there's also a lot of the lung and large, so I'm disappearing into this. There's lungs and large intestine meridians, that run through the arms, and then a lot of tapping you can do over the lungs. There's quite a lot of movement that involves the arms that helps the lungs, and breathing practices as well. So, but maybe we can do that on a cough one.
As I said, we'll do
Yeah.
another video on that, because that will require another video altogether. But today was good. Thank you so much,
Yes.
Sam, and thank you to
Thank
all the
you.
viewers. And hopefully, we've helped. We will be helping a lot of people.
Yeah, and
Who probably are. Yes,
subscribe, share, like, leave us a
yeah. The more,
comment. What was that?
they need to subscribe, right? Like if they
Yeah.
don't subscribe, they're gonna miss all our good videos.
Yeah, we need your support. We're out here because we want to share from the heart, and what we believe a lot of people need to hear and may not be aware of. And in order for that to happen, we need to kind of get out there.
Yes, and yep, wonderfully. Please subscribe, and Sam and I will be back again with a great topic next week. And we haven't thought about the topic yet.
Thank you, Ashwin. Have a beautiful
Thank you,
day.
Sam. Thanks.
Bye.
Bye.